Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example, an 11-year-old Cocker Spaniel with progressive cough for 2 weeks. The coughing has produced a white mucus. Once you have reviewed the radiographs using a systematic approach, you're ready to watch this video. So here we have a great example of an enlarged heart. Radiographic evaluation of cardiomegaly can be tricky. In particular, I think this is because it relies a lot on experience. There are many criteria that are available which can be unreliable, especially when used in isolation. But a great thing about this case is it has so many criteria of cardiomegaly that we can definitely believe it. So, beginning with the lateral view. The heart is wide and tall. I would say this both subjectively when I look at the intercostal space occupation by the heart, when I look at the sternal contact of the heart, when I look at the reduced space between the heart and the diaphragm, and when I look at the tracheal position, which is elevated. One of the major findings that I see in this case is enlargement in the region of the left atrium. And in fact, although I'm pretending like I can trace the left atrium for you, I really can't. There is some summation in this area and border effacement or silhouetting due to pulmonary pathology. But at least some of this margin here is the left atrium. And when we talk about the caudal cardiac waist, this line here should be going directly towards the carina, and instead you can see it's going quite dorsally. So many reliable signs of heart failure are noted on the lateral view. On the ventrodorsal view, I again see that the heart is subjectively wide. I can appreciate that there's enlargement on the right side of the heart. That can be unreliable, but it could support right-sided cardiomegaly in this case. One thing that I want to point out is the subtle curvature or bulge here in the 2 to 3 o'clock position. This is consistent with left auricular dilation and is a common finding in dogs with mitral regurgitation. Let's look at the lungs. Whenever we're concerned about an enlarged heart, we should make a special assessment for congestive heart failure. One of the things I like to do is look at the pulmonary blood vessels to see if they're large. In this case, there's so much lung pathology that there's border effacement of the vessels or silhouetting, and I don't see their margins. Overall, I think we can all appreciate that there's a severe increase in soft tissue opacity in the lung, and I like to use the VD view in order to show that this is substantially worse on the right side and worse in the caudodorsal lung field. However, all of the lung lobes are affected by a mild interstitial pattern, but in the right caudal lung lobe, I would characterize it as an alveolar pattern. So taken together, these findings are highly consistent with cardiomegaly with left atrial enlargement. Suspected right heart enlargement is less clear radiographically, but should definitely be considered. In older dogs, this can be due to chronic mitral valve insufficiency, or in this breed, dilated cardiomyopathy could also be considered. Of course, echocardiography would be needed for definitive diagnosis. The lung pattern is highly consistent in location with cardiogenic pulmonary edema. Be sure to read the full report for this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.